If you're a fitness and health enthusiast who has experienced pain or injury from performing exercises and stretches like these, then stick around to discover better ways to breathe and use your core to help you not only feel better, but perform better. Before making specific recommendations, let's define some useful terms. Belly or diaphragmatic breathing is the respiratory function of taking air into your lungs through your nose. It's accomplished through contraction and lowering of your diaphragm muscle, which lies in between your lungs and your abdomen and acts as the floor of your rib cage. True belly breathing should cause expansion of not only the upper part of your belly outwards, but also the lower parts of your belly. The sides of your belly should expand out sideways. Even the lower part of your back should expand. All of these regions should be a part of normal diaphragmatic breathing. Finally, diaphragmatic breathing coincides with chest expansion. Therefore, a bit of chest breathing is a normal part of belly breathing. Bracing refers to contracting your abdominal belly muscles in order to protect and stabilize your low back and pelvis. A few important details regarding bracing that you need to understand. How hard you contract your belly muscles should be directly related to the intensity of the task at hand. The shape of your belly should not change very much when bracing. Particularly, you should not suck your belly in when attempting to stabilize your low back. In fact, it is acceptable for your belly to protrude out a little bit when bracing properly. Finally, your brace can help you pull down and reposition a flared rib cage and pelvis, which can provide you with a more effective posture to stabilize from. Lastly, we have a concept called intra-abdominal pressure, or IAP. This pressure is the actual source of stabilization for your low back and pelvis and is created when you combine bracing and breathing. As your belly expands outward with diaphragmatic breathing, your abdominal muscles will brace against that expansion, which generates the small amount of IAP necessary to stabilize and protect your low back and pelvis. To summarize, if you want to effectively protect your low back and pelvis from pain and injury, you have to be able to learn to brace and breathe with quality and endurance so that you can generate the necessary IAP required for the task at hand. Now that we're all on the same page, let me show you some things to avoid while exercising, since they will make it more difficult for you to effectively brace and breathe. Avoid hyperextending your low back or flaring your rib cage when attempting to stabilize your back and pelvis. You definitely want to limit this type of posture during any active exercise. For quality breathing, avoid ballooning out only the upper part of your abdomen. This strategy makes ideal stabilization difficult. Also avoid excessive hypercontraction of the six-pack ab muscles, and do not hollow out or suck in your belly when attempting to effectively brace. And now that you know what not to do, let me finally show you what effective ideal stabilization actually looks like. Here we see some examples of quality bracing and breathing involving active lowering and repositioning of the rib cage through abdominal muscle activation, which elongates the lower back and places your diaphragm and pelvis into the ideal position to function. Notice how the breath is spread throughout the entire abdomen while a slight brace is maintained as both the belly and chest expand. This is ideal effective stabilization. So now that you know what to do, I suggest you start implementing these strategies into your current yoga and Pilates practice so that you can start to move and feel better as soon as possible. If you've tried some of these suggestions but still have significant symptoms or would just like a professional evaluation all performed in the comfort of your own home or place of business, please consider following the link in the description to book your private appointment with me today.